This video will highlight why the quality of blood cultures matters and how managing the infection right first time is so important for our patients here at BTHFT. More than 1/3 of all our emergency admissions are associated with an infection, and 1 in 3 inpatients are being treated with antibiotics at any given time. The purpose of taking blood cultures is to identify the bacteria that are causing the infection. Therefore, lack of blood cultures or poor quality blood cultures can often result in the undertreatment or overtreatment of an infection. Both can affect patient experience, including longer recovery times, prolonged length of stay, and even increased morbidity and mortality. Together, we can improve the quality of blood cultures taken. This could improve the treatment of infections for thousands of patients under our care every year. There are 4 rights in relation to blood culture practice. These are the right time, the right volume, the right technique, and making sure you get the cultures to the lab in a timely manner. Join us on our mission to get infection management right. Let's first discuss the right time. There are specific times when blood cultures should always be taken. These are prior to commencing IV antibiotics for acute infection, as soon as possible following a suspicion of sepsis, when a patient is already on antibiotic therapy but fails to improve or deteriorates, or for other reasons if instructed to following medical review. If blood cultures can be taken before the first dose of antibiotics, this will increase the likelihood of identifying the bacteria causing the deterioration. However, for patients with severe sepsis, whilst blood cultures are a time-critical intervention, they should never delay antibiotic treatment beyond the 1-hour target. Now let's discuss the right volume. Each blood culture vial, where possible, should contain 8 to 10 milliliters of blood. The reason being, even for patients who have bacteria present in their blood, not every milliliter of their blood will contain bacteria. We know that when we take 1 set of blood cultures, this carries with it a 65% chance of detecting the bacteria causing infection. There are a few instances when more than 1 set is required. For example, patients with suspected endocarditis or patients with long lines in situ. Please avoid overfilling the blood culture bottles. They are designed to detect maximum bacteria when filled with 10 ml of blood. In this film, I'm going to explain the correct procedure for taking blood cultures with the butterfly needle using aseptic non-touch technique. Prior to actually taking the blood, there are some simple tasks to be performed first. Introduce yourself to the patient, ensure you gain consent from the patient to take the samples, fully explaining why this needs to happen, including any associated risks with taking the sample. Wash your hands using hand gel or, if visibly dirty, use the 7-stage hand washing technique. Then gather up the equipment you will need. Don your PPE and prepare your equipment. Before taking the sample, mark the blood culture bottles to ensure 8 to 10 ml of blood is collected within each bottle. Remove the dust caps from the blood culture bottles, remembering that the bottles are not sterile underneath the dust caps. You should then clean the tops and stem of the bottles with a separate wipe and again leave to dry for 30 seconds. Open the Vacutainer collection system, ensuring you protect the key parts. Remove your PPE, wash or gel your hands, and don a clean apron and gloves. You are now ready to take the sample from the patient. Palpate the arm to find a suitable vein. Clean the arm over the vein area with a 1 ml ChloraPrep applicator. To break the seal, squeeze each arm to hear a snap. Clean in a crisscross action. Remember that once clean, you should not go back and repalpate, or you will need to clean the arm again. Leave to dry for 30 seconds. You can now insert the butterfly into the vein. Once you can see flashback, you can insert a blood culture bottle into the Vacutainer collection system, ensuring you keep the culture bottle as upright as possible to prevent any accidental backflow of the broth in the bottle. It is important to remember the correct order to draw from the blood culture bottles. The aerobic blue bottle should be used first, followed by the anaerobic purple bottle. This is because there may be air in the tubing on the first sample, and if you take the anaerobic bottle first, this air can impede the growth of anaerobic organisms. As a reminder, when obtaining blood, we need to aim to obtain 8 to 10 ml of blood into each of the blood culture bottles. If you are struggling to obtain blood, try and fill the aerobic bottle blue as a minimum. Take any of the samples required at this point, but remember blood cultures should always be taken first. Once samples have been collected, remove the butterfly and apply non-adhesive dressing and pressure to the arm to prevent bleeding. Then dispose of the butterfly as per trust guidance. Label the bottles at the bedside. When collecting the sample, please ensure time taken is documented on the requisition form. Dispose of any equipment or packaging in appropriate waste stream. Remove PPE, wash or gel your hands. Send the samples to the lab as soon after the samples are taken if possible. If taking a blood culture from a peripheral venous cannula, this should only happen from a cannula that is being newly inserted. Blood cultures should not be taken from existing peripheral venous cannula. Attach an extension, set the newly inserted cannula and clean the lumen with 2% chlorhexidine alcohol wipe. The extension set should not be primed prior to connecting the cannula. If taking a blood culture from a central venous access device, ensure a sterile field is maintained throughout the procedure. Place a sterile towel under the line, clean the lumen with 2% chlorhexidine alcohol wipe and allow to dry for 30 seconds before proceeding. Attach a 20 ml syringe, withdraw 20 ml of blood and inoculate both culture bottles with 10 ml each, ensuring aerobic bottle first. If you have a multi-lumen device, consider if you need to take cultures from each lumen and repeat above as required. Always take a peripheral blood culture sample at the same time as a CVAD sample. Now that you've taken the time and care to get good quality blood culture, make sure you deliver your samples to the microbiology lab as soon as possible. The sooner they arrive at the lab, the sooner the bacteria can be detected. We need our cultures to arrive in the lab within 1 hour of the sample being taken. This ensures the culture can be incubated and bacteria detected as early as possible, giving patients the best outcomes. So, to summarise, without identification of the actual bug causing the infection, we're unable to provide the best level of infection care and treatment to our patients. The overuse of broad-spectrum antibiotics is causing an increase in antimicrobial resistance across the world, making it increasingly difficult to treat infection and causing multi-resistant bacteria to spread, limiting the effectiveness of antibiotics in the future. So, together, Let's get blood cultures right so that we can treat infection right, first time. That's the right time, the right volume, the right technique, and ensuring it is received in the lab within an hour. Thank you for listening to this video.